First of all, tell us a bit about where you are geographically and what you're doing clinically and kind of get us oriented.
Yeah, so I am in San Antonio, Texas. I am working in an outpatient orthopedic clinic with Texas physical therapy specialists. I graduated South in 19, so I've been working for a little over a year and just finished up my orthopedic residency. I did that right out of grad, right after PT school, and I've been really enjoying it. So it's been super cool. Yeah.
Awesome, Kim. That's great. So, Kim, near the end of your time with South, how did you start finding out about job opportunities? Did you find that they were plentiful? Did you find that you had a lot of options? I know a lot of folks who are thinking about going into PT school are wondering about that side of things. So, how did
Yeah.
you come about finding opportunities?
So, my situation, I was very, very blessed with where I was placed in my internship with South for my terminal internship. Uh, so it's actually a funny story because they give you the option of your terminal internship to split it up like 3 months, or do a full 6 months somewhere. So in PT school, I was super interested in actually like acute care, like ICU care,
Okay.
because I loved my rotation there. So I was like, I think I want more experience there. I'm going to do 3 months like in my outpatient setting, and then do another 3 months in Dallas with a pulmonary specialist, and I do in patient stuff.
Cool.
So my first 3 months were here at this clinic with Tex PTS, and developed like a love for the location I was in because it's really unique, because we share the building with a bariatric center. So we get a lot of patients with um, a lot of comorbidities. They've had bariatric surgery, whether that be gastric sleeve, gastric bypass, they may be pre-op, non-op, XYZ. And so I kind of fell in love with that population here, which is really unique, I think, to a lot of the clinics or just a lot of outpatient clinics in general. And kind of my 3 months were, my first like few weeks were going by. I was like, oh, I really like this. Like, I wonder if they're going to be hiring. And then about like week 6, my CI pulled me in for like a meeting and was like, hey, we're growing a lot. We're looking to hire. We want you to extend your internship so you can build a caseload, so you can be here with us 6 months and then start post grad. So like I said, it was a lot of like contemplation, like thinking about it, like different opportunities, but it just kind of seemed like everything fell into place just perfectly. So I was very fortunate in terms of that. So I didn't necessarily have to look for a job because I had the opportunity set right after. Obviously, it wasn't guaranteed, but kind of built up the contract like towards the end of my internship, and then just had to pass boards, and then I started in August. So
Sweet.
yeah.
That's awesome. So with the residency, that's another really hot topic. People,
Yeah, yeah.
is the cost benefit there? What do you get out of it? What were your thoughts on it? Why'd you choose to do it? And could you give us some reflections on kind of looking back at that decision that you're wrapping it up?
Yeah, absolutely. So I really debated like not doing it. Obviously, like it's a great opportunity. I would have been able to do it here where I was hired and everything. And I was, no lie, like pretty burnt out by the end of PT school, because I went straight from undergrad to PT school. Then you're studying for boards while you're in internship, and it's just all just So I had a conversation with my CI, and I was fortunate enough to have a very good relationship with her. And she's our clinic director, so she would be my boss.
Cool.
So like we chatted, I was like, what do you think? Like, she's like, well, you're not required to, like, you could always do it down the road, XYZ. And I was like, nah, I know myself too well. Like, I have
Yeah.
momentum right now. And like, if there's any time to do it, it's now, because I'm still like, I was looking at like my life as well. Like, I'm not married, I don't have kids yet and everything. So I was like, this is the time to really like invest in myself and my career and my education. So I just like, I pushed for it, I did it, and my CI ended up being my residency mentor as well. So I got to like
Awesome.
study under her for sure. So that was cool. But we also got a lot of like really good experiences with the fellows that were in the company here in South Market in San Antonio. And they were like, residency rounds were like phenomenal here. And I know everyone has different experiences, because I've heard from other people that they don't have the same experience as me in residency rounds. But looking back at it, like the amount of not necessarily like, yes, clinical growth, like myself as like a clinician, but like personal and like human growth
Mm,
in the past year being pushed in residency was priceless. So it was,
awesome.
I would do it again for sure.
Awesome. Cool.
Yeah.
So looking back, Kim, at the South College's preparation of you as a clinician, what are a few things that you felt like we really did well as far as getting you ready to be a clinician, to be out there serving patients? Were there some things that you would say are really fond thoughts you have about the preparation you had for your professional endeavors?
Yeah. I will tell you, when I entered my internships, I never felt like I didn't know anything.
Mm,
Nothing was new to me. So in terms of like just the basic didactic work and like basic sciences, like I felt very, very prepared. Um, Also, something very unique to South College, and I will say this a million times, is the pain science course.
yeah,
And because of like how much I use that as an intern, and then I got to develop that skill as a resident as well, and having that baseline knowledge of it and what it actually is was like night and day of like how I would be as a clinician. And
yeah,
and then you dive into it more like as you keep developing the skill of like T&E and like understanding persistent pain, especially with how the world is today. I've seen so many new patients come in that are just like chronic pain, like bunch of yellow flags that need to be managed and everything. So I think it's just super, super important. So it's a lot of what
sweet.
you see. Yeah.
That's awesome. So now I've got to ask the more challenging question, Kim. Where
Mhm.
could we have done better? So as you compare yourself to other new grads, or you kind of reflect on where you felt there were some gaps, where do you look back and say, "Oh, I wish I would have gotten a bit more of this," or "I wish this would have been a bit different." What jumps out at you there?
Um, I don't know if it's anything necessarily that like South did. Like the only thing I think it was for me is it is accelerated, so it is very, very
Yeah,
challenging, and there's a lot thrown at you. In general, whatever program you're in, you're going to be drinking out of a fire hose,
sure.
but it's like you're drinking out of like two fire hoses because it's like so much faster. But looking back, like I still have all my resources from school that I go back to, but I will say like sometimes it was challenging to absorb it all like in the moment. You always had to go back to your references, which I think is like with anyone really, but
Sure.
it depends on like where you as a student, like where
So
you feel
last question,
weaker,
I
where you
won't
feel
take up your whole
stronger, and like what you
afternoon.
focus. No, you're good. So I
Where are you
think that's
going
where
from
what
here? We're
really
always
depends.
curious what our graduates' plans are, next 5 years. Are there certain
Yeah.
things you're really looking to accomplish, areas you want to make your mark? We'd love to hear about that.
Yeah, so I think I'm taking it in strides. Like,
Cool.
definitely graduating residency was a really big accomplishment. Now my brain's just focusing on studying for the OCS.
Yeah.
But something that I've taken on recently within the past like few months here. So our building, yeah, we have the bariatric center, but we also have a bariatric counseling center that is upstairs.
Mhm.
So, gotten a little bit closer relationship with them, and I'm actually doing some movement and exercise sessions for them upstairs, like twice a week, every other Saturday. Because we teach Zumba here at my clinic. So I got my Zumba certification, so I'm like a Zumba instructor, and so I teach it to them upstairs just to like get people moving and educate them um, on proper movement, like the right range of movement, kind of like squashing this fear or like the stigma they have behind exercise,
Yeah.
which I think is just so important because especially here in San Antonio, like the obese population is insane.
Mm.
And I know that like metabolic disease is like on the rise. And I just think it's just so important for like healthcare in general. And if people are just a little less sedentary, like it's the smallest thing that can make the biggest difference. And I think that's what I'm trying to promote to them, like my patients in here and then the patients upstairs as well, because they've been really, really awesome and like really responsive. They love dancing and Zumba, and it's funny. So I remember Dr. Odegaro, like in lab one time, literally went on mic and he's like, Kim, stop dancing. So I was like, I'm gonna be a Zumba instructor. So I made it work in my favor, I guess.
Yep. That's wonderful. Awesome. Well, Kim, where can people track you? Are you on Instagram? Do you spend any time on social anywhere that our next graduates and our next wave of students can follow you?
Yeah, I am on Instagram. It's not like a professional Instagram, but it's just like my personal one. But I have no problem if people want to reach out. My Instagram handle is actually Kimberly, Kimberly _ Elise, ALYCE. And then my email for Text PTS, like my personal email is ktovar@textpts.com. So I'm pretty
Awesome.
responsive to that. So yeah, awesome.
Awesome. Well,
Cool.
thank you so much, Kim. We really appreciate it. We're spreading the word of South College far and wide, so it's great to hear how you all are doing and what's going on.
Yeah.
So thank you so much.
Yeah, South has been the biggest blessing, so happy to do it for sure.